Hi everyone. In this video, we will be talking about how will COVID-19 shape urban planning. So the big ideas that we will be looking at are as follows. To understand how urban planning is connected to the spread of diseases and how pandemics can reshape our cities. The current crisis raises several questions about our cities. How can we ensure equitable access to open spaces and help build immunity and health? Can active mobility play a role in designing and restructuring of urban spaces? Now, aims for change. To take the lessons from COVID-19 as an opportunity to rebuild inclusive, compact cities that lead to healthier ways of living. To address all these aspects in the long term, cities must holistically consider the people, economy, and the environment. Taking a look back, throughout history, pandemics such as the Black Death, cholera, and SARS have reshaped the planning, management, and sanitation systems of cities. COVID-19 will add to that list, influencing key aspects at the intersection of urbanism and diseases. This pandemic tells the story of rapid urbanization and human encroachment on natural habitats, which leave us increasingly susceptible to unknown pathogens that originate in animals. However, it also illustrates the tale of how actions are no longer restricted to a local effect. COVID-19 is really a story of peri-urban and rural to urban connections in places that are often not on the global consideration. Now, the digital benefits that we are living. The mega cities of our times ensure that the entire world is connected through a series of transport, production, and consumption networks. The digital revolution has also brought the world together, making this pandemic different from previous ones. The advancements in urban data have allowed people to track the virus seamlessly and could inform city planning in the coming years. Modern planning and civil engineering were born out of the mid-19th century development of sanitation in response to the spread of malaria and cholera in cities. Digital infrastructure might be the sanitation of our time, actually. Now, the good thing about high-density streets. Compact cities have sustainability benefits, meaning that dense environments foster health and build resilience, preventing the growth of sprawling car-centric cities. The array of options, medical transit, and housing available in these areas allow users to make the switch when one system fails or proves to be unfeasible. Compact cities have sustainability benefits also due to density increasing mass transit being possible, and it allows for more affordable housing. It also creates environments where people can walk, where children can find also playgrounds. When cars and public transit are shut down, services in dense neighborhoods can usually be accessed by walking or cycling. Compact cities are more favorable to services from the private sector, such as food, retail, hospitality, and leisure. We should also remember that stories of citizens delivering essential goods to people in need and checking up on the elderly have shown that tightly wound social networks can save people, especially during emergencies. The lessons in urban planning from COVID-19 created opportunities for the transport sector as well. The importance of the hyper proximity, the Parisian idea of 15-minute mixed-use neighborhoods that provided all amenities while being connected by walking and cycling can lead to safer, cleaner streets that prioritize pedestrians. This is also evident from the staggering increase in active mobility during the lockdown, which has been prompted by further various initiatives from local governments. The impact of interconnected infrastructure for active mobility to influence travel behavior of urban residents was something that has been also looked at by the United Nations Economic and Social Commissions for Asia and the Pacific. They suggest that certain type of infrastructure which promote active mobility, meaning exclusive walking and cycling lanes, walkways and wide footpaths, cycling tracks, interconnected parks and resting areas along the routes. It's also important that these are backed by policies, funding, and advocacy to ensure long-term framework for the city. UNESCAP presents 5 key strategies. Basically, the first one is plan compact cities based on public transport and active mobility. Prioritize active mobility as part of public transport. Plan and develop related infrastructure for active mobility. Developing resting areas and public parks, and improve environments along walking and cycling routes by planting trees and beautification. For cities to prepare themselves in the future, CityFix proposes 5 strategies that planners must keep in mind. Focus on access to core services such as water, housing, healthcare, and when planning for density, which will ensure that people in highly crowded cities are able to handle pandemics effectively. Affordable housing and public spaces. There's going to be an additional 2.5 billion dwellers by 2050, and it's important that cities frame laws and policies to improve existing informal settlements and to provide access to affordable housing and healthy living conditions. Integrated green and blue spaces. The coordination between green spaces, water systems, and built infrastructure will avert natural disasters, meaning that flooding is one big example, or temperature changing in global temperatures. Build resilience and lead towards climate change mitigation and environmental sustainability. Increase city regional planning. Integrated economic, social, transport, and energy planning of regional areas will ensure that the ripple effects of local actions are foreseen and controlled. More city-level granular data. Strong digital infrastructure through the integration of public and private sectors at the local level can inform long-term planning through data-driven approach. As lockdowns stretch in many areas and many places, we are only beginning to understand how COVID-19 will affect how we approach urban planning. Plan for properly density is a good thing for cities, and it will again be a good thing. We will rebuild our crucial economic and social fabric. It's our decision to rebuild better, as CityFix says, and as we all agree. So building back better for a green and sustainable economic recovery. A resilient future, in that sense, means that we need to make our cities resilient. This pandemic has highlighted some weaknesses of our approach and offers us the possibility of reorienting ourselves. We can act now to make our cities resilient, not just to deal with a pandemic, but to mitigate the worst effects of the climate emergency. Countries around the world have only 10 more years to attain sustainable development goals, and it's imperative that the urban resilience acts as a pivot to achieve them. Long-term solutions must focus on the vulnerable, integrate decision-making, and encourage local leadership in the fight against climate emergency. The transformation in mobility, retail, office culture, food dependency, and data privacy must combine equitable advantages for the society and the environment. As cities adopt a slew of policies to bounce back better and faster, the ones that focus on adaptability and environmental resilience will be the ones that survive. And the best thing about this course is that we will be looking on how to do these things in simple, efficient ways that are not also being costly.